My name is Mary Maki. I have lived in Cheltenham for about 20 years. Born and brought up in Kenya, came here as a student. I was a student with Florence at the University of Gloucestershire. When I finished that course, I worked with the NHS, mental health services, for about 12 years. I retrained and did a master's in social work, and now I work for children and families. I want to hold on to the good things that happen within children's services because we get a very bad press, isn't it? I don't think people really appreciate how much work goes into working with children and families. And some families can be quite complex. For us, we're still just working. We're doing the same things that we did before. The only difference is that probably we're working more from home. But we're still going into families' homes. We're still seeing children face to face. It's things as usual for children's services. Every child is seen. No child is left at risk. So we need to understand one thing in terms of the BAME community. In this country, there's only 14% of people who are BAME. But then if you look, for example, in just the prison service, 25% of just the BAME community in the prison services are open to mental health services in prisons. So that's a very high number. Then you ask yourself, why is that? Why are they getting that service in prison, but they're not getting that service when they're not in prison? So what's happening there? So we need to understand that Black and ethnic minority families, a lot of them are predisposed to mental health problems, and that there is social determinants that affect that. So when we think about those social determinants, we think of things like poverty. We think of things like racism. We think of things like migration. Migration is massive in terms of that experience of migration. And also the expectations versus realities of migration, because a lot of people came into this country. The expectation is not what they actually thought it's going to be. In terms of understanding why did they not access mental health services before they went into prison, we know they're overrepresented in prison. We need to look at some of the things in terms of accessing services. One of the things that BAME community find very difficult in terms of accessing services is language. So we have a lot of I grew up in a country where we spoke English from the time we were young. English was taught in schools. But a lot of the people who migrated into this country did not speak any English. So you will find that, for example, Bengali community, Pakistan, people from Pakistan, there's a lot of them who don't speak English. So universal services, so that is the primary mental health care. So I'm talking about the pathway where you first go to access services. It will be your GP. So they'll go to the GP, but as far as I'm concerned, I don't know how much it's funded in terms of accessing an interpreter. They would go there, they would say what they're suffering from, but then sometimes they get misdiagnosed. For example, I am from the culture I come from, we're very expressive, so I'll go to the doctor and I'll say, I'm depressed, but I'm making all these gestures. And the doctor will say, I don't think that's depression. I think that's schizophrenia because I'm manic. I'm all over the place. So there's been a lot of misdiagnosis because of professionals not understanding our culture. They're not sensitive to that. What is crucial to me more than anything else is the stigma behind cultural norms of what they perceive mental health to be. I come from a country where if I saw anyone with a mental health problem, they would be at their worst. They would be really unwell. And for me, when I came into this country and I got a job in the mental health services and somebody said, oh my God, you're going to be working in a ward, in a mental health ward. My goodness, I was thinking I can't, because my cultural understanding of mental health problems is at its worst. And I'm thinking it's because it wasn't treated early. So a lot of people will not access those services because of the stigma associated to mental health problems. So there's a lot of barriers in people accessing these services.